today with Dr. Qadri, and she does a ton of co-management, so we're going to get a lot of good pearls from her today.
Optometry has become such a full scope of practice now. There's so much to it, so much medical side to it, so much in co-management, which we'll talk about. And I think that it's really up to us to break that barrier and pull through.
With co-management, a lot of people have different perceptions of how that works and what their role is as the referring optometrist or as an optometrist in general. So how is the setup in your practice between, you mentioned that you want your MD doing surgery because that's what they're trained on and do great at, and you spend a little more time with the patient. How does that dynamic work amongst the three of you as far as, some people think maybe the little competition? How does that work?
Like I said, we have over 300 referring optometrists. So we are not trying to take the patients from them. What we want our patients to have is, giving an example, we do cataract surgery all the time and refractive lens exchange. So when we do cataract surgery, the patient has already been seen by their optometrist for the past 20 years, and they've been fitted in monovision contact lenses for the past 5 years and are very successful in it. Then it's time for them to get cataract surgery. So now at this point, the patient says, well, why don't you go see Dr. Doherty? Then the patient comes to me and I take a look at their eyes, make sure and check everything from the front of the eye to the back of the eye. And it becomes a very easy and seamless process because now the patient has already tried on monovision contact lenses, they're already successful in it, and then we just have to put exactly that into the surgery. Now the patient feels very comfortable of their optometrists they've been seeing for years and years telling them that versus seeing me or Dr. Doherty or Dr. Lee and us telling us that, those patients that from 5 minutes. So it's really that relationship, and then once we're done with the patient, we send the patient off to the referring optometrist. If there's any complications or anything like that, the patient then sends back to Dr. Lee and myself, and then we take a look at the patient and evaluate from there.
Yeah, I completely agree. I worked in a similar practice to yours for quite a few years, and one of the biggest parts of that was that relationship with the referring OD because, like you said, the patient's seen them for years. They have a rapport. They know that they can trust that person, and now they're seeing us for a minute, in their grand scope of eye care. And so to know that you can communicate that with the referring OD definitely makes a difference. How do y'all go about that? Do you tend to write letters? Do you call? How does that work for you?
We have a pretty extensive process of how we do it. With our referring optometrist, we send them a letter with everything that we found. We communicate with them. Anytime I'm seeing the patient for anything, if it's a complication like a pressure spike or anything at all, I always communicate with the referring optometrist, and we're in constant communication. And I think that's really the key to co-management, is the key between the surgeon and the referring optometrist, and then internal optometrists as well, which is myself and Dr. Lee. All of us really communicating between each other and taking care of the patient and getting them the best refractive outcome.
So what do you think an OD going into private practice or any kind of primary care setting should look for when they're looking for a referral site? So if they're looking to find a cataract surgeon or a refractive surgeon, how do they know that it's the right fit?
This surgeon that you end up choosing will be an extension of you. For me, I'm almost honest to a fault, so I had to pick somebody who I really believed in. Dr. Paul Doherty is absolutely fantastic, and not only is he great at surgeries and extremely experienced, but he has amazing bedside manner. Because these referring optometrists need to remember that these surgeons are going to be an extension of you. And as excellent as you are, the surgeon needs to be just as much, if not more. So one of the things that I tell optometrists to look out for is, what's their experience like? What's the surgeon done in the past? What's their success rate? What's their percentage of complications? Get to know the surgeon. Maybe have lunch or dinner with them. Go to a couple of CEs and attend their CEs and see what they talk about and what they talk to the patients about. You can come into the clinic and actually watch what the surgeon does. You can go into the OR and watch what the surgeon does. I mean, I did that myself before even joining Doherty Laser Vision. because if I was going to be with him, I needed to really believe in him. And I think that's exactly what the referring optometrists need to do.
You tend to move to a town, maybe you know the people there, maybe you don't, but you kind of look and see who's the busier practice. You start to get a feel for where most people refer, but I don't always think that's necessarily where you should refer just for that reason, right? You should go and investigate the practice yourself. And a lot of
Exactly.
people don't realize that they're open to having you come by or having you, shadow for a day and see how they actually do their things, because in the long run it benefits both parties. The more you know about them, the more you know about what's going to happen for your patients when they're there.
That's what I really believe in. I think that if you go in, and we have that policy in our clinic, anybody who wants to come in and really see what we do, they can absolutely do that. And I think once you build that trust, then you're really able to take that and move it further. When referring optometrists call me and they tell me the refractive outcomes that have came from them co-managing the patient and Dr. Doherty doing the surgeon, it is one of the best feelings I ever have, because we've taken care of that patient from day one, and now they've had this surgery. They're doing extremely well, because refractive surgery, if we want to believe it or not, or if we want to accept it or not, is the future. And I think really people need to start accepting it. And another thing I really tell the referring optometrists as well is that it's also a profitability thing. You are getting checks for these co-managing these patients. A lot of times what happens is you'll get a VSP exam, and you'll give the patient a glasses or contact lens exam, and the patient then ends up going online and ordering their glasses and contacts online, and now you've completely lost the patient except for the copay of whatever that exam was. Whereas with the co-managing fee, you see these patients at post-op appointments, you take care of them, and it's huge profitability for you too.
Yeah, that's absolutely true. More and more these days we're seeing patients walk with scripts and going elsewhere to get different things because there's a lot more options for that. But with the medical side of things, that has to stay in-house. You can't go online for your co-management. You can't go online for your cataract surgery or your LASIK or whatever it may be. You mentioned that you're, pretty fresh out of school, loving what you do, which is awesome. How did you get comfortable being in such a, quick-paced medical setting? Did you ever feel a little overwhelmed when you first got out?
Absolutely. Absolutely. I definitely did. We see a ton of patients, and initially, actually, when I was in school, I did a rotation at Dr. Greg Parkhurst in San Antonio. He's fantastic. So when I was doing my rotations, actually, he's the one who inspired me to get into all of this. And when I saw that, I knew in the back of my mind, this is what I want to do. A lot of studying. It took a lot of studying, and I'd encourage new grads. So I did this, and being honest as I am, what I used to do is when I started working at Doherty Laser Vision, I every week would see something, maybe something I didn't know. I would write those things down and maybe have a list of 5 or 10 things at the end of the week. Then I would spend the weekend studying those things, and the week after, I would come back and I would be better equipped to maybe answer those questions for those patients. I would walk into rooms with Dr. Doherty all the time to see what he's doing and what he's saying, to really understand the core of the surgery and what exactly we're doing here. It's still a learning process. I'm still learning every single day. But I tell and encourage new grads to really study the material that you have. Don't just think that what you're doing that's the way to go. I think you have to be constantly evolving, and that's the key. For me, I came in with thinking I know nothing. And I think that's the best attitude, because when you go in there and you think you don't know anything, you come out learning a lot of things.
I felt the same way when I went into my practice. I was in a referral setting where, the doctors that were sending to me expected me to know what was going on with their patient and to be able to manage that. And you feel a little, fish out of water at first, but the more that you do it, the more confident you get, and you learn. Like you said, I pulled out my Will's eye manual daily for a while, and went to the surgeons and said, hey, what do you think we should do with this? And then you gain more and more, confidence throughout that.
And that's the thing. You also need to be working with someone who is very comfortable with answering those questions. Not everybody has a teaching personality.
Yeah.
There's some people who would feel that you asking them questions is a waste of their time. And I think when you're picking an employer that you're going to work with, make sure it's somebody who's comfortable with answering your questions, because believe me, you will have questions. every single person has questions, and I wasn't afraid to ask them. If I had anything, I would just go up to Dr. Doherty or Dr. Lee or anybody that I knew, and I would ask them those questions, and they would happily answer them for me.
I think a lot of people have the perception that sometimes these surgeons think they're so much smarter than us or so much better than us at different things, and that's completely not true for a lot of them. I'm not going to say all of them, but a lot of them. And when you're looking for a position like this, if you think you want to be in co-management, I 100% agree that you've got to work with somebody that you're going to be able to communicate with, because at the end of the day, you're both people, you've both got to work together, so you build that relationship from the beginning, and and then you'll start to see things that they think you're better at. I mean, our surgeon used to call me all the time and be like, hey, I know you're better at refraction. Can you come, check this patient because I need help on this? Like, it becomes a very mutually beneficial relationship, right?
Dr. Doherty actually jokes around that Dr. Lee and I are his right and left hand. And that's pretty much what we're doing. He's doing what he's best at, and then we take care of clinic from there. And in order to really be strong at that, you have to continue to learn. I mean, I'm learning every single day. And exactly as you mentioned, there's going to be some things that you're actually better at, and you can really take that to your advantage. And I think as a new grad, one of the most important things is maybe write down some of the things that you're really strong at, and then play at those strengths at your practice. If you feel like you're very good with patient interaction, talk to your doctor. Let them know that, this is what I'm really strong at, and they'll play at that, and they'll do different things to really utilize that strength that you have.
So what kind of background do you need? Do you have to do a residency to be in a co-management position? Do you need to, be super focused on disease externships? How do you really find your way in that role?
So I recommend everyone for rotations to pick ocular disease sites. If co-management is something you're interested in, pick a site that does peri-op and work with them and see exactly what they do. I think doing ocular disease for your rotations as much as possible is extremely important, because even right now, there's a ton of things I see regardless. And I'm doing general optometry and general ophthalmology all the time too. I mean, I'll get those pink eyes and glaucoma patients, diabetic retinopathy, all of that. So I say pick rotations that are based on ocular disease and peri-op if you're interested in that. If you want to do a residency, I think that's great. I think residency will never hurt you. I was way too eager to get out of school and just start. And I think the fact that I picked one of my rotations to be Dr. Parker's office in San Antonio, it really elevated me to that position to already have some of that knowledge. And then I took the rest of the time to really study and practice everything. And I think that's what got me to where I am today. So,
yeah, I think that's interesting that you mentioned that you don't have to do a residency to be in that kind of role, because I think a lot of times some students assume that you do in order to be hired by the practices that you would do co-management work with. And that's not always true. Some of them do. Some do require that, but not every single one of them. And if you've got a background in disease through your rotations and you know that you can come in and confidently do it, that's usually going to be enough for them,
Exactly. And you have to be strong in clinic. I mean, when I was in school, I took clinic very seriously. So for me, it was extremely important for me to learn every single aspect of clinic and really see what's out there. You have to continue to learn, and I think that's really important. Residency, I think, is fantastic if you do it, but if you don't do it, I think you have to work extra hard, because then you have to really start exposing yourself to all of the things that are out there, because you always have that moment where somebody comes into your clinic and you see something and you're like, what is that? And sometimes residency does better equip you for that. But I think that if you're spending that time outside of clinic studying for these things, you won't have those moments.
What would you say, just kind of tie it all up in a nice little bow, what would you say are the top 3 things that you would recommend to any student or new graduate that thinks they might want to get into the kind of role that you are currently in?
So number 1, do your research. I think look up surgeons around your area that you're interested in. Look up their experience. Go meet them in their practices. So do your research. Go see them. Go into their OR. Watch the surgery. Watch clinic. I would suggest doing all of those things, and make sure they're optometry friendly. That's also important. So do your research, number 1. Number 2, never stop learning. Every single day, the minute I start work to the time that I leave, I don't stop learning. I never think that I'm good enough. I always have to continue to learn. So I think continue to have that attitude that I'm going to take this information, go home, and really study this. And talk to your surgeon about it, ask them questions, ask the people that you work with, ask them questions. And number 3, which is maybe just with any practice, is just be kind. I think, sometimes people really forget to do those things, and I think that's such a key thing to success. For me, I've always told myself, no matter what position I'm in life, I will always be kind to people. And I know that doesn't really go with co-management, but I think it goes with any practice. So if you do those 3 things, you will be successful. 100% you will be successful.
Yeah, I love that. And you're absolutely so dead on with that, especially in co-management, because when they come to those practices, so many times they're a little scared. These patients are being referred for something that they need treated, and maybe they fully understand it, but probably not. And the more kind that you are and the more human and personal that you are, I think the more that patient really comes out benefiting in the end.
Yeah, sometimes we really take that for granted, and we don't realize that when people are getting surgeries, it's their vision. They're scared that they're not going to wake up and have their vision anymore. And if you're being kind and you're being supportive towards that patient, not only is it going to build your rapport with that patient, but it's also going to build you as a doctor. And I think that's so important. So I always say that be kind. I think it's extremely important in a practice, and you'll be successful.
Well, thank you so much for joining us today. I know we could probably do 3 of these and touch on all kinds of stuff, so maybe we'll do another one soon, but we really appreciate having you. So good luck with everything. I know you'll keep doing awesome things.
Thank you so much. I really appreciate it. Thank you.